Hello students, welcome to the channel Nursing Rhythm. So today we are going to learn about a very important topic, that is organization of neonatal care unit. So this is an important topic of your child health nursing subject. So we will start the topic, organization of neonatal care unit. The neonatal care unit is also known as NICU. So neonatal care unit is a specialized unit where critically ill neonates are cared of to reduce mortality and morbidity rate. So mortality rate is the death rate and morbidity is the disease rate. So here in intensive care unit, this is a specialized unit that is exclusively made for the critically ill neonates. Now we will see the next slide, that is the level of NICU. So there are three levels of NICU: level 1, level 2nd and level 3rd. So one by one we will see. The level 1st care. This care is for the care of neonates, those who have weight more than 1800 grams and the gestational age should be more than or equal to 34 weeks. And here in level 1st care, the care consists of basic care at birth, the provision of warmth. There should be maintenance of aseptic technique while caring of the baby. There should be promotion of breastfeeding. One more point is there, that this type of care can be given at home, at sub-center level or at primary health center. So the level 1st care is for the neonate, those who have weight more than 1800 grams and the gestational age will be more than or equal to 34 weeks. Now we will see the level 2nd care. So the level 2nd of care is given for the care of neonates who are weighing between 1200 to 1800 grams and the gestational age will be between 30 to 34 weeks of gestation. And these neonates are looked after by trained nurses and pediatricians, and this type of care is given at the first referral unit, the FRUs, and the district hospitals, the teaching institution, for example AIMS, or any other institution, and nursing homes. Now we will see the level 3rd care. So the level 3rd care is for the neonates who are weighing less than 1200 grams and the gestational age will be less than 30 weeks. And this type of care is provided by skilled nurse and neonatologist. So this exclusive care is given at places like intensive care unit of Apex institution, and those institutions equipped with central oxygen supply. The suction facility should be available in those institutions. Then servo control incubator should be available, vital sign monitor, transcutaneous monitor, ventilators, infusion pump. So you can see the pictures of radiant warmers. Then ventilators should be available in those kind of Apex institution, then incubator. Now we will see the indications for admission in NICU. So if a baby is having very low birth weight, if a baby is having weight more than 4 kg, if a baby is having any history of birth asphyxia, meconium aspiration syndrome, if a baby is having a history of severe jaundice, if an infant is of a diabetic mother, if a baby is having any kind of neonatal sepsis, then the babies who are having severe congenital malformation, for example cleft lip, cleft palate, then the cyanotic congenital heart disease, if the baby is having any kind of episodes of convulsion, if the baby is having unstable heart rate and breathing, if we are going to have exchange blood transfusion, then if the baby is having any kind of injury, then we are gonna send the baby to NICU. Now we will see the aims and goals of NICU. So the first and foremost aim is to improve the life of sick newborn. The second aim is to improve the condition of critically ill neonate. As we all know that we are going to treat the critically ill neonate in NICU. So here we are going to improve the condition of such neonates. Then the third is to monitor the high risk newborn to reduce the mortality and morbidity in these babies. The fourth point is to provide continuing in-service training to the medical and nursing personnel in care of the newborn. So NICU can provide a great opportunity for the person who are serving in the hospital for getting the continuing in-service education. Then we will see the physical facilities that make a critical care unit an ideal newborn intensive care unit. So the NICU, an ideal NICU should have a single area, or it can be it can be in the form of multiple rooms with a capacity of 2 to 4 infants each. So the physical facilities include, if we are talking about the location, then NICU should be located close to the labor room and obstetric care unit, so that it will be easier for the staffs to send a critically ill baby from the labor room to the NICU. Then the room should have adequate sunlight for proper lighting. Then the room should have proper ventilation for the fresh air. Then if we are talking about the space, then the minimum area should be 100 square meter. There should be separate space for breastfeeding. There should be a area for breastfeeding. That should be 500 to 600 gross square feet per bed. Then there should be 6 feet gap between two incubators for adequate circulation and for keeping all the essential life saving equipment, for example suction apparatus, and etc. Then if we are talking about the floor plan, then there should be open space, walls should be washable and have glazed tiles. The windows should have 2 layered glass panel. The wash basin with foot or elbow operated taps should be available, and the water should be available there round the clock. Means in 24 hourly there should be water availability. Then the door should be provided with automatic door closer. Then we will see the ventilation. For ventilation, effective air ventilation is very important, and there should be effective air ventilation and as well as central air conditioning. Then if we are talking about environmental temperature, then the temperature should be 28 degrees Celsius, and that can be plus 2 degrees Celsius, like 29 or 30. Then if we will talk about the lighting, then the whole unit should be painted white or slightly off white, so that it helps in detecting the jaundice and cyanosis. The lighting is well achieved by cool white fluorescent tubes. Spot illumination should be available so that some of the procedures can be done easily. For example, the cannulization procedure. The lighting arrangement should be provide uniform shadow-free illumination of 100-foot candles at the baby's level. There should be lighting that should not allow to form shadow there, so that the staffs can do their work easily. You can see in this picture. Now we will talk about acoustic characteristics. So if we will talk about the sound intensity in the unit should not be more than 75 decibels. The telephone rings, the equipment alarms. So this is the first part of the video. Stay tuned to the channel for the second part. Thank you for watching.